Hello everyone, it's Mike, and I'm doing some class prep right now on some upcoming workshops on thoracic outlet syndrome, carpal tunnel syndrome, sciatica, and I thought I would ask what seems to me like a really basic question, which is, what is nerve entrapment anyway? If you're like me, at some point you were given a metaphor for a nerve, which is that a nerve is like a wire, and this wire connects the central nervous system out to some innervated tissue. And what's happening with nerve entrapment is that the wire at somewhere along its length is pinched or crimped or tugged. And in that model, your job as a clinician is to find where it's pinched or crimped, relieve that mechanical stress, and hopefully restore the nerve's function. Well, that might be helpful for some folks. I would contend that most people who experience nerve entrapment are having something that's a little more subtle, a little more complex going on than this wire metaphor will allow. So for the time being, let's do away with the nerve as wire idea. And instead, let's think of a nerve as an ecosystem. It's an ecosystem that runs from the midline of the body out to the innervated tissue, and it's a system that's organized around the conducting fiber at the center of the nerve. This whole system is trying to accomplish a constant and comforting environment for that conducting fiber. So, what are the components of this system, and how do they respond to stress? Let's take a look at a typical nerve, like the axillary nerve at the shoulder, and let's zoom it in and realize that a nerve is really a pressurized tube of dense connective tissues. It's enclosing a fluid space. And on the inside of that fluid space, there are smaller tubes we call fascicles that are packed in to the interior. And those fascicles have some ability to rearrange on the interior of the nerve. Each of those fascicles contains many smaller tubules we call endoneurium, which then finally contain the conducting fiber itself. So already you can see that it's an important aspect of this nerve that it has this nested arrangement of tubes, which allows this tiny, delicate projection to travel vast distances from midline to periphery and experience lots of different mechanical stress. All the while on the inside of that endoneurium, it's pretty quiet, it's pretty constant. Why? Because of this intricate arrangement of connective tissue layers on the outside. Second thing you might notice about this system is that it's got rich blood supply. Nerves are surrounded by and penetrated by blood vessels, which supply the interior of the nerve with glucose and oxygen and everything the nerve needs to maintain its resting potential, to heal itself in times of injury. The last thing to notice about a peripheral nerve locally is that it has its own nerve supply. Nerves have a tiny little nerve supply which help regulate the blood vessel diameter and also regulate the immune activity locally at the nerve. So that's what's happening at a nerve locally. How does this system experience stress? Well, if you've got somebody who's experiencing nerve entrapment, you want to be on the lookout for three basic things, and I call them the three I's. Okay? You want to be on the lookout for ischemia, inflammation, and injury. Let's take ischemia first of all. Ischemia means lack of blood flow, right? That can be very transient or it can be very chronic. And you know from having sat on your butt too long that the longer a nerve is deprived of adequate blood flow, the more dysfunctional it can become. And you might also notice that nerves have really creative ways of getting the blood that they feel they need when they're deprived. So be on the lookout for sites of disrupted or altered blood flow to a peripheral nerve. Secondly, be on the lookout for inflammation. Inflammation can be initiated locally, can be initiated regionally or systemically, but in each case, a nerve has the ability to swell, has the ability to become sensitized mechanically. So you can oftentimes detect sites of inflammation just by palpating along the path of a nerve. Lastly, be on the lookout for injury to the nerve. This can become this can come about as a result of acute mechanical stress, like a tug on a nerve, or it can come about due to chronic insufficiency of resources for that nerve. So you've got kind of a degradation of the interior components. In either case, you've got some kind of loss of integrity to the connective tissue layers of the nerve or to the actual conducting fibers. And it can be very mild, easily healed. It can be quite severe and be pretty challenging to heal. That's nerve injury. So as a clinician, you want to be able to identify sites of ischemia, inflammation, and injury along the whole continuity of a nerve. And you want to be aware that these phenomena have upstream and downstream effects. So they talk to each other along the continuity of the nerve, which means that you're better off treating multiple sites along the path of a nerve than you are just trying to find the one spot to treat. And so if you can do that, if you can identify those sites, know that they talk to each other, and if you can listen to this nervous system, to this whole person, respond to how the system responds to you, I think you have a more subtle model for how to treat peripheral nerve entrapment. And I hope this video was helpful. If you're interested, I'll keep trying to post stuff about it. But have a good evening, and there's nerve entrapment.